Okay, here we go. Okay, source VP located after low risk exposures. HIV. As clinicians, it's very important that we orient ourselves in terms of how to identify HIV by asking the right questions, and kind of prophylaxis can we give ourselves and to patients who might be at a suspected risk for HIV. So the signs and symptoms here would be signs of infectious mononucleosis, looking for lymphadenopathy, a rash, headache, as well as any unusual signs which indicate that someone is having a recurrent infection. So recurrent oral candidiasis, recurrent shingles, and leukopenia. Okay, now with all that out of the way, you're probably going to be more on edge to do investigations. The best investigation for any HIV patient will always be a good, thorough history. After that, you can start thinking about your FBCs, your viral loads, your CD4 count loads, and your RNA load as well. You can start thinking about prophylaxis, both for yourselves and for patients as well. So with PrEP, which is pre-exposure prophylaxis, it's more to do with keeping yourself safe. And if you do find yourself exposed to the virus or to someone who may have the virus, simple and conservative ways of keeping yourself safe. Follow your local guidelines if you have needle stick injuries. Check up on yourself every three to 6 months, and ensure that if you have had contact with someone with HIV, and ensure that you are up to date on all of your vaccinations. Ensure that you have filled out all of the incidents and you're getting the appropriate support from your trust or from your hospital. Furthermore, what happens if you actually have the infection but now you need appropriate treatment? So we'd like to stick to 2 forms of medical management. One of them is called with a scheme of 3 different medications, not 4. So one of them is Kaletra, which involves the use of lopinavir and ritonavir, and then the use of Truvada, which might be some people who struggle to take Truvada more than others. So you can replace the Truvada with another regimen called Combivir. The most key important thing that we haven't discussed is prevention. Think about patients who might be having sex with men. In that case, you want to explicitly ask, are you having sex with other men? If you are looking after someone who is having sex with other men, ask, are you using condoms? And if they're not, try guiding them to the right resources, as use of condoms has helped to prevent a lot of STI exposure. Ask about sexual tourism and promiscuity, as that again increases the number of partners that a patient might have exposed themselves to, which can increase the chances of contracting HIV. Also asking about needles, so asking if they have been exposing themselves to needles and sharing needles in particular, and if at any point they agree or they might let on that something is pointing them to HIV risk, you must ask them if they have gotten themselves diagnosed or when was the last time they have seen a sexual health clinic, because diagnosis and early treatment can make a world of difference for patients with HIV.